Hello everyone, welcome back. It's Dr. Zum, your favorite physical therapist. Today I'm going to be giving you guys some exercises to treat your jaw pain, otherwise known as TMD. So with TMD, there's really a few different things that you can see. So it can be either muscular related, either weakness or over tension from guarding at nighttime. It can be joint related, so more arthrosis really on the joint surfaces, on the cartilage. Or it can be disc related. So when you open your mouth, if you feel like your range of motion is restricted or you feel a click and a pop, and when you open your mouth, you see your mouth deviate to one side. So if you open and you see that, like a little C shape, or you see definitely some disc involvement. So no matter which group you fall into here, I'm going to have some exercises for you guys to do to help you feel better. This first one, I'm going to need you guys to feel the actual joint. So I'm going to turn to the side here. There's a joint right here, that's your jaw. So I want you to go this part of your ear here. You're going to go right in front and down. I want you to open your mouth, and you should feel your jaw start to slide forward. So you're going to keep your finger there on both sides. And for this exercise, this helps to strengthen temporalis, the masseter, and on the inside, the medial and lateral pterygoid. So what I want you to do is get back into there, so feel here, down, and I want you, when you open and close, to focus on making the jaw, when it opens and slides forward, have it slide the same amount. So, second part, tongue is going to be pushing on the roof of your mouth here. It helps if you look in a mirror and you can kind of make sure that your jaw is going down in a straight line. You really got to be pushing up with your tongue, and you should feel like the muscles on the inside and the outside working. And that'll really help to stabilize your joint and prevent further damage to the joint surfaces. If you're someone with restricted range of motion in your jaw and you feel like you can't bring your mouth to one side as far as the other, then what I want you to do, you're going to have your finger, you're going to go right in the middle of your teeth. And I want you to, when you're in this position, I want you to move your jaw first off to the left. You're gonna come like this, and you're keeping your finger there. So what I want you to do is, once you get there, you're gonna push. You're gonna kind of bite, but very, very lightly. It shouldn't be painful, just enough to activate those muscles. So hold for a second, go back to the center, come back. Next exercise is another exercise that's really helpful for strengthening the lateral pterygoid to keep that disc moving properly. So what you're going to do, you have one of your hands going to be right behind your neck here, just kind of right at the base of your skull, and then other hand is going to be right in front of the chin. So what I want you to do is push your jaw forward like this into your hand. I want your hand to resist that motion so you're not actually allowed to go through it. So just like this. So hold for 2 seconds and then go again. Hold for 2 seconds. This is another thing. There's been some research done with this particular exercise where the connective tissue behind your disc, through doing this exercise, can be remodeled and converted into disc tissue as well, which can really help to decrease the pain. You might still feel the clicking, but it'll be pain-free. Next one is very, very helpful for people that clench at night and for people that have anxiety. It's very common with TMD to have some sort of emotional factor with it, purely because usually the pain lasts for about 4 years before anyone goes in to seek treatment, and it becomes chronic. So what happens when that sort of pathology develops is the sympathetic nervous system starts to really get amped up and hold on to that pain. So a way to quiet that sympathetic nervous system and to break up that chronic pain input is you're going to take your fingertips and you're going to do two different things. So we're going to work on the masseter, and we're going to work up here on the temporalis, because these are the two most common places when you're night guarding to receive pain. What I mean by that is clenching your teeth at nighttime. So what you're going to do is take your fingertips here. You're going to start just above this bone. So again, using this as a reference, just up, you're going to feel a bone that goes right across here, your zygomatic arch. You're going to go just above it, and you're going to push in and lift here. You're going to go up a little higher, push in and lift, and you're just going to feel for the tension. just do 2 to 3 second holds. You're gonna work your way all around this muscle. But most importantly, just above that zygomatic arch, holding for 2 to 3 seconds here. So the masseter is a muscle that goes just below the zygomatic arch here and extends down to the angle of your mandible or your jaw. What I want you to do here is fingertips again, and you're gonna push in and up, hold for a couple seconds, in and up, hold for a couple seconds, back in here, into the front. So, the next thing I want you guys to do is going to be cross friction. So for this one, you're going to be using your knuckles. This is another one that's good for the people that clench their teeth at night. So what you're going to do is the exact same muscle. So the muscle fibers here go this direction, and the muscle fibers for the temporalis go up and back. So you're going to want to use that when you're doing the cross friction, because you're going to go directly across it. So you're going to hold here, mouth slightly open, going right along those muscle fibers, and it should feel pretty good. You're gonna feel some trigger points. When you feel those, try to hold pressure for 30 seconds. Same thing up here, the exact same motions. Well, it does seem simple. It's something that really, really helps. It's very effective, and I've seen a lot of my patients get a lot of relief from it. Okay. So one last thing that should really help with the symptoms in your jaw is working on the mobility of your upper cervical spine. So the very top through C3, so CO through C3. If it's immobile, it can contribute to symptoms, and usually there's not a cause and effect relationship, but they do sort of happen at the same time. I've seen a lot of patients with TMD, most of them have upper cervical spine immobility. So what you want to do is grab a little towel here, and you're going to situate it right at the base of your skull. So just like this. And what I want you to work on first is looking down, so holding pressure the whole time, pulling into your head, and then looking up into extension. And you're going to kind of orient the towel with your eyes. Just like that. So for that one, you can do about 30 reps just looking up and down. You don't have to hold it for any particular period of time. For this next one, I do want you to do 3 second holds, and you're going to be holding opposite arm here. So opposite arm here, and then the other one here. You're going to pull the towel right across the zygomatic arch, that same bone we were using a little bit ago. And what you're going to do is you're going to rotate, hold, rotate, and hold. And you're going to want to do 20 of those on each side. That'll help increase the rotation at those segments I was talking about in the upper C-spine, which should help to decrease that pain. All right, that's everything for today. Thanks for stopping by. I appreciate you guys watching. Please give me one of these, subscribe, and I'm going to get you guys some more great content, okay? All right, stay healthy.